My name is Nidhi, and the topic I will be presenting is about nurse incivility and bullying. Define bullying. First, let's begin by understanding what bullying is. Within nursing, it's perfectly described as repetitive and destructive behaviors aimed at degrading or tormenting a fellow nurse. Bullying can take a variety of forms. These forms can range from rudeness, exclusion, extreme harm, and violent threats. Background. So, when did bullying first come to light within healthcare? Unfortunately, the rivalry has always been at the heart of the nursing profession. During the Crimean War, there have been two types of nurses: paid and unpaid. Paid nurses came from a lower social class and they were not widely liked because they were seen as doing their role for the money, while unpaid nurses were given higher prestige since they were there with more moral power. This hierarchy between the two types of nurses was the start of the hostile environment within the nursing profession. Purpose. A few important points I want you to take away from this presentation is that this is the serious ramifications bullying has on its fellow nurses, the nursing profession, patient care, on a nurse's role, and the healthcare organization as a whole. First, let's begin by discussing the impact bullying has on nurses. Because nurses are regularly exposed to workplace bullying, it creates a lot of physiological problems. Since this issue, it includes hypertension, heart disease, anxiety, stress, and sadness. Not only are nurses physically and emotionally burnt from bullying, but bullying creates a state of constant stress. This only hinders a nurse's ability to perform well. Bullying also has a terrible impact on the nursing profession. It creates an environment of exhausted nurses, which ultimately forces them to change facilities or even careers in extreme cases. The turnover rate within the nursing career ranges from 8.8% to 37%. This means that nurses have a stronger urge to leave their jobs and use more sick days due to the poor job satisfaction associated with bullying. Bullying has a detrimental impact on patient care as well. Bullying impairs a nurse's ability to concentrate, which results in more clinical errors being made. This not only compromises a patient's safety, but it also negatively affects the treatment outcomes for patients. In addition to this, bullying also clouds a nurse's abilities and their judgment, which in turn puts patients' lives at jeopardy. Let's shift the focus on how a nurse can limit bullying that goes on within their facility. Specifically, it is the nurse manager's duty to settle any conflict that rises within the floor. The nurse manager should appoint a guidance counselor to whom other nurses can report to without the fear of retaliation. Specifically, the ANA organization believes that any type of harassment that goes on should not go on and should not be tolerated with the nursing profession. They also believe that in order to prevent incivility from progressing into bullying or violence, a shared and persistent commitment to promote dignity and respect is required. Let's go over the organizations involved with bullying. Specifically, there are two organizations that are involved to prevent bullying: the ANA and the American Organization for Nurse Leadership. The ANA works with nurses to promote a culture of civility, while the AONL focuses on eliminating bullying through the use of experienced nurses as role models. Pros and cons to bullying. The negative effect to bullying is that nurses are emotionally affected by it. This in turn causes them to have both physiological and emotional issues regarding it. This not only translates to their work, but it causes them to make mistakes, which in turn jeopardizes patient lives. There's only one pro to bullying, and that is that it's used as an example of what not to do. The advantage of bullying is you're able to see firsthand the consequences associated with it. This in turn teaches nurses how not to act. Legal aspects associated with bullying. The legal aspect notes that the victims of bullying within the nursing profession must record incidents of bullying. This is because a nurse who takes part in bullying can be breaking the law by harassing a coworker. There are two ethical aspects associated with bullying. The first one being non-maleficence. This means to do no harm. As a nurse, we should never inflict pain to others. This includes both patients and our coworkers. The second ethical aspect is beneficence. This means to always promote good. As a nurse, we should always act with kindness, which means not partaking in bullying. My opinion within bullying is that bullying not only takes away a person's desire to practice medicine or work as a nurse, but it also puts them in emotional misery. I believe that we must all play a role in preventing bullying by recognizing the steps to deter it. I think that intervening can prevent numerous consequences connected with bullying, which in turn results in better working environment for nurses.